On the basketball court, there lurks a silent menace, an unseen threat that strikes when least expected, the dreaded ACL injury. The anterior cruciate ligament, or ACL, is a key player in the game of our body's mobility. It's like the star point guard of our knee, controlling much of the movement and stability. However, in the high-impact, high-speed world of basketball, it's often under tremendous strain. Young players in particular can fall prey to this injury, with consequences that can sideline them for months, even years. So, how do you know if you've torn your ACL? The signs can be as sudden and startling as a buzzer-beating shot. Firstly, you might hear a distinct pop at the moment of injury. It's like the snap of a rubber band breaking, a sound that can send shivers down the spine of any athlete. Secondly, you'll probably experience severe pain. This isn't your average "I bumped my knee" kind of pain. This is a sharp, intense pain that makes even the simplest movements feel like you're trying to dunk from the free throw line. Lastly, your knee may swell significantly within the first few hours after the injury. It's the body's way of sounding the alarm and protecting the area, much like a coach calling a timeout when the game's getting tough. These symptoms don't always mean you've torn your ACL, but they're a strong signal that something serious might be up. It's like when your star player starts limping. You don't ignore it, you take action. In the world of sports, knowledge is power. Recognizing these signs is crucial because it determines your next move on this unexpected journey. It's like knowing when to pass or shoot. The right decision can change the game. Knowing the signs of an ACL tear is the first step towards a quick response and recovery. But why are these injuries so common in basketball? Let's dive into that in our next scene. Stay tuned. Why do so many basketball players tear their ACL? It's a question that has puzzled many. You see, the anterior cruciate ligament, or ACL for short, is a critical stabilizer in the knee, and it's particularly susceptible to injury in sports like basketball that involve a lot of jumping, twisting, and rapid changes in direction. Picture a basketball player in action. He's sprinting down the court, swiftly changing direction to dodge an opponent, then leaping up to make a shot. All these maneuvers put a tremendous amount of strain on the knees, particularly the ACL. Now, imagine this happening repeatedly over the course of a game, a season, a career. It's not hard to see why the ACL can eventually give out. Another factor at play is the very nature of the game. Basketball is a contact sport. Collisions are a part of the game, and unfortunately they can sometimes result in an awkward landing or a direct blow to the knee, both of which can lead to an ACL tear. Moreover, basketball players often play on hard, unforgiving surfaces, which can increase the impact on the knees. Then there's the footwear. Basketball shoes are designed to provide grip, but this can sometimes work against the player. If the foot sticks to the floor while the body is twisting, the ACL can be put under extreme stress. So, it's a combination of the fast-paced, high-impact nature of the game, the physical demands placed on the players, and the environmental factors that make ACL tears so common in basketball. But once an ACL injury occurs, what next? How long does it take to recover? That's a question for our next scene. Stay tuned as we dive into the healing process of an ACL tear and what you can expect on the road to recovery. The road to recovery from an ACL tear is not a sprint, it's a marathon. But how long is this marathon exactly? Well, if we're talking about timelines, we're looking at 6 to 9 months for a full recovery. But it's important to remember that this can vary depending on several factors. Factors like the severity of your injury, your overall health and fitness level, and how well you adhere to your physical therapy and rehabilitation program. So, let's talk about the big question. Will I ever be 100% after ACL surgery? To be honest, it's not an easy yes or no. The good news is that most people can return to their previous level of activity after ACL surgery. However, it might not feel exactly the same as before the injury. You might notice a bit of stiffness or a slight decrease in flexibility. But with a well-executed rehabilitation program and a dash of determination, you can certainly get close to your pre-injury form. Now, it's important to note that an ACL tear isn't a death sentence for your athletic career. Far from it. Many athletes bounce back from this injury and return to their sport, often performing at the same level, if not better, than they did before the injury. But it's crucial to remember that recovery isn't just about time. It's about putting in the work, being patient with your body, and trusting the process. One thing to keep in mind is that your mental game plays a significant role in your recovery. It's not just about physical healing. Your mindset can make or break your recovery. Staying positive, motivated, and focused on your rehabilitation can significantly speed up your recovery and get you back on the court sooner. Recovery is a process, but there are ways to aid it. Let's explore some of them. Ice or heat, massage or rest? The answers to these questions can make a big difference in your recovery. First off, let's tackle the age-old debate, ice or heat. In the immediate aftermath of an ACL tear, ice is your best friend. It reduces swelling and numbs the pain. A good rule of thumb is to apply ice for 20 minutes, then give your knee a break for 20, and repeat. But remember, don't place ice directly on your skin. A towel or cloth should be used as a barrier to prevent frostbite. As your recovery progresses, heat can be helpful. It increases blood flow, promoting healing, but it's not a free-for-all. Heat should be used sparingly, and never on an inflamed or swollen knee. Now, what about massage? It's a bit of a mixed bag. While gentle massage can help with scar tissue mobility and promote circulation, a heavy-handed approach can do more harm than good. Always remember, the key word here is gentle. But what else aids in healing a torn ACL? Well, physical therapy is often the cornerstone of recovery. It focuses on strengthening the muscles around your knee to provide better support and prevent future injuries. And let's not forget about nutrition. Your body needs fuel to heal, so make sure you're consuming a balanced diet. Protein in particular plays a key role in repairing and building tissue. Hydration is also vital. Water helps in flushing out toxins from the body and keeps your tissues healthy. So, keep that water bottle handy. In addition to these, adequate sleep and rest are essential. They allow your body to focus its energy on healing. Finally, a positive mindset can go a long way. Staying optimistic and focused on your recovery can actually speed up the healing process. Believe in yourself and your capacity to heal. As crucial as these tips are, there are some things you should definitely avoid when dealing with an ACL tear. When it comes to ACL injuries, knowing what not to do can be just as important as knowing what to do. So let's delve into the don'ts of a torn ACL. First off, don't ignore the pain. It's your body's alarm bell reminding you that something is not right. Also, avoid high-impact activities. They can exacerbate the injury, causing more harm than good. Now, a common question that pops up is, can an ACL grow back? Well, the answer is, unfortunately, a big fat no. The anterior cruciate ligament, or the ACL, lacks the necessary blood supply to heal itself. It's not like a lizard's tail, folks. Once it's torn, it's torn. But here's the silver lining. While you can't regrow your ACL, you can certainly strengthen the muscles around it. This can provide added support and stability to the knee. So engage in low-impact strength training exercises, focusing on your quads and hamstrings. But remember, always under professional guidance. Another crucial point that needs addressing is the delay in ACL surgery. It's like procrastinating on your term paper, but with higher stakes. You might think, hey, I can still walk, it can't be that bad, right? Wrong. Delaying surgery can lead to further damage and long-term complications. It's not a matter of if, but when the injury will catch up to you. In the end, the most important thing is to listen to your body and seek professional help. The internet is a great place for information, but it's not a substitute for a doctor. Remember, always consult with a doctor or qualified healthcare provider. If you are enjoying the content, don't forget to share. Hit that like button and subscribe for more awesome videos, and ring the bell to stay updated. See you next time.